Hi, South Texas. It's great to be with you again for this edition of the South Texas News. It's incredible, but fiscal year 2020 is nearly over. It has been a very interesting year. It has definitely been a challenging year. I know it has challenged me as an individual, many of you as individuals, and definitely as a healthcare system, more than we ever expected. But I'm so proud that as individuals and as a healthcare system, we have exceeded all expectations of our patients and of our community. It's been a tremendous effort. Starting with our COVID-19 response, because of your resiliency as a healthcare system, we were not only able to care for thousands of COVID-19 positive patients in our outpatient and inpatient settings, but also be one of the leaders in VA's execution of Fourth Mission, caring for civilians throughout the state of Texas, and doing so with the support of other VA facilities here in the state of Texas and throughout the continental United States. And for that, I couldn't be prouder. We were also able to sustain access to our healthcare system at a time when many in VA and in the state of Texas were shuttering their doors because of fear of spread of the virus. Because VA is a leader in virtual health, we were able to continue to see our veterans, keeping them safe in their homes using virtual modalities like VA Video Connect and telephone visits. And we're, because of that, able to even sustain our growth as a healthcare system, welcoming new veterans into the healthcare system. So just very proud of that. Also proud of our continued growth in our labor force. So when the economy was going down, millions of Americans were experiencing unemployment. We had the opportunity to welcome them into our organization and onto our payrolls as we hired hundreds of additional nurses, physicians, therapists, administrative personnel, engineering staff, housekeepers, food service workers, you name it, and we hired them. And I'm really appreciative for our hiring managers, for human resources, for helping us execute that important mission, not just to VA to ensure we're able to continue to care for our veterans, but for also those millions of Americans that were unexpectedly faced with unemployment. And so again, we appreciate your efforts. Equally proud of the clinical quality improvements that have sustained in the healthcare system in the midst of all the unexpected chaos that fiscal year 2020 brought with it. That included starting this fiscal year with 5-star ratings in our community living centers in Audie Murphy and Kerrville, and finishing the fiscal year with those same 5-star ratings. So extremely proud of our geriatrics and extended care staff and nursing personnel and others that help us maintain that level of quality for our very important population in our community living centers. In addition, even though the star rating systems for hospital-based sale were discontinued, many of the metrics still existed. It was really impressive to finish this fiscal year with only one single red indicator, a significant improvement over where we were in FY19. So we continue to improve quality across the board, whether it's CLC or hospital-based care, and just extremely proud of the quality that you're delivering to our nation's heroes. Last but definitely not least, we are still on our high reliability journey and continue to make amazing progress, and really saw the COVID-19 pandemic as an opportunity to put those high reliability principles to the test. And because of the infrastructure that our quality, safety, value leadership is building throughout the healthcare system, we gave all of you an opportunity to continue to contribute in the areas of safety, quality, and experience, and to allow us to continue to be a learning organization, even in the midst of our physical separation during the COVID-19 pandemic. So that included those forums that we held, again this year holding 3 forums on quality, safety, and value, and rotating those on a regular basis, which is really amazed with the input and questions from the staff at those sessions. We've seen our joint patient safety incident reports go up, and not only increase overall, but we've seen significant increases in near-miss reporting, and that's exactly what a high reliability journey is all about. So really proud of you there. And we continue to make progress in the area of experience, whether we look at our V-Signals trust scores, which were at their highest levels in the 90th percentile over the past 90 days, as veterans continue to tell us they trust us to provide the care and services that they need. But we're also seeing those same gains in our SHEP surveys and HCAP surveys that veterans are completing after inpatient stays or outpatient visits. So extremely proud of the progress that we're making in high reliability. Now let's talk a little bit about fiscal year 2021. So fiscal year 2021 starts October 1st. And I'll tell you, it's going to be a very exciting year for the South Texas Veterans Healthcare System, and it's going to help us continue our transformation. And now, this is going to be the year of building. What I mean by that is we're going to build and continue to build a safer healthcare system. So our high reliability journey that we started last fiscal year is going to definitely continue in fiscal year 2021, and I continue to hear positive things from you, from your leaders, about the change in the culture that you're feeling in the healthcare system, and that's exactly what we want. And as a result of that change in culture, creating a psychologically safer and a more process-oriented environment, we're definitely going to get closer to our goal of achieving zero harm. We're going to continue to build a more accessible healthcare system. We've made significant investments, not just in virtual health, that obviously we all had an opportunity to experience during COVID-19, but we've made investments in physical infrastructure. We've made additional investments in teams, for example, in primary care and behavioral health, that we're adding staff to ensure that as the fastest growing VA healthcare system, that we're able to welcome those new veterans that are moving to South Texas and choosing VA for their healthcare, to ensure that we can provide them a timely and accessible access to VA healthcare before we have to face the possibility of sending that care to the community. We're going to build a larger healthcare system. Many of you have been tracking the Northwest Healthcare Center. This will be our large ambulatory care center off of Rogers Road in 151. 240,000 square foot facility. It's going to have primary care, behavioral health, specialty care, dental operatories, you name it. We're going to have some aspect of that outpatient footprint located at that facility. Really excited to see that progress continue. One of few construction projects that was not delayed during the COVID-19 pandemic, so we could expect the handover of that facility as early as July, or possibly as late as September, and we'll keep you in the loop as we get closer to that. And last but absolutely not least, we're going to continue to build a more compassionate healthcare system. I've heard great things from you all, giving me feedback about what we're doing with our new Chief Experience Officer and with the Organizational Experience Service, and how they supported you during our COVID-19 pandemic, from the whole health events that they sponsored, to the prayer sessions with our chaplain service, to the meal deliveries that they did, to a multitude of services. I really heard great things about that, and we definitely expect that to continue in fiscal year 2021. So again, it's going to be a great year. I look forward to seeing it through with all of you, and couldn't be prouder to serve as your medical center director. Now, in the rest of this video, you're going to hear updates from other members of the executive leadership team. They're going to be telling you a bit more specifically about what's happening in the areas under their purview, and about the great things that themselves and their teams are accomplishing, that they did accomplish in fiscal year 20, and what they're expecting in fiscal year 2021. I'll talk to you next time.